The emergency room was silent for just a second, and then chaos. Doors burst open. Sirens screamed outside. Paramedics rushed in, pushing stretchers one after another. A bus had crashed on the highway, dozens injured, some critical. The hospital was about to drown in pain and panic. Amidst the shouting and rushing footsteps, a small woman quietly pulled on her gloves. She didn't speak. She didn't demand attention. She simply got ready. A young doctor leaned toward his colleague and whispered, "She's new. She won't last. Probably just good for paperwork." But they didn't know her. Not yet. For the next 3 hours, this quiet nurse would do something that left the head surgeon speechless. Something no one in that ER would ever forget. Her name was Laura Keating, 32 years old, Irish-American heritage, long brown hair, always tied back neatly. Calm eyes that noticed everything. It was her very first day at St. Alder's Hospital. She arrived early when most of the staff hadn't even shown up. She opened the medicine cabinet, checked supplies one by one, made notes. Prepared as if every second would matter. Nobody cared. Nobody even noticed. One young doctor smirked at her. "Why so careful? This is the ER. If we run out of something, we just call for more." Laura didn't argue. She simply smiled. A small, quiet smile. But inside those calm eyes, there was something different. Her first shift had barely begun when she noticed something others missed. A patient had strange bruising patterns. Everyone thought it was nothing. Laura looked closer. Her instincts screamed. "Internal bleeding," she told the attending physician. They checked, and she was right. That man's life was saved because she noticed what no one else did. The family never forgot. They left her a note and a small box of cookies. "Thank you for noticing." But inside the ER, her colleagues only complained. "She's too slow. She's too quiet." Even the charge nurse pulled her aside. "Maybe you should work in the back office. You don't seem cut out for frontline care." Laura just nodded. But something flickered in her eyes again. A fire she kept hidden. Week after week, the same thing repeated. Others ran around loudly, trying to prove themselves. But Laura moved, like a shadow, quiet, precise, adjusting IV lines, noticing breathing problems others missed, checking vital signs when no one was watching. She kept a small notebook. She wrote down every case, not to boast, not for recognition, but to learn, to get better. Her locker was almost empty, just clothes, a water bottle. But in the pocket of her scrubs, she always carried a silver pen, engraved with 2 letters, DP. In medical terms, it meant differential pressure, a hidden sign of danger, a reminder that the deadliest threats are often the quietest ones. Lunch breaks? While others laughed and gossiped, Laura sat alone, a simple sandwich in one, hand medical journals on her phone in the other. She wasn't here for gossip. She wasn't here to fit in. She was here for something else. One afternoon, a patient from a car accident was brought in. He was awake, talking. Everyone thought he was stable, but Laura saw it. The skin tone, the pupils, the shallow breath. She quietly told the doctor, "Doctor, we should run a CT scan immediately." The doctor waved her off. "He's alert. We have more urgent cases." Laura didn't argue. She never argued. 2 hours later, that patient collapsed, internal bleeding. He survived, but barely. No one remembered Laura's warning. No one gave her credit. But she remembered. She noticed everything. And then came that night. The night that would change everything. The night the entire ER would finally see her for who she really was. The radio crackled with an emergency alert. Multiple vehicle collision. Bus versus semi-truck. 14 casualties. ETA 7 minutes. The ER transformed into a battlefield. Dr. Whitmore, the head surgeon, barked orders like a general. All hands on deck, senior nurses, critical patients, residents, minor wounds. Then his eyes landed on Laura, the new nurse. The new one takes Station 4, paperwork only. No medical decisions without supervision. Laura simply nodded, her face calm. No reaction. No one in that room knew what was about to happen. No one knew that this quiet nurse was carrying a past far heavier than any of them could imagine. The first ambulance screeched to a stop. Doors slammed open. Paramedics rushed in, pushing a stretcher with a middle-aged woman. She was awake, whispering softly, but her skin... Laura noticed it instantly. It wasn't just pale. It was gray. And that gray meant one thing. Her blood was slipping away inside her body. Laura's assignment? Paperwork. Just write down the patient's details while the resident checked her vitals. But while the resident saw normal numbers on the monitor, Laura's trained eyes saw something else. Her breathing, her blood pressure, her skin tone. A silent storm was building inside the woman. Without waiting, Laura started an IV line. She began fluid resuscitation, calm, steady, quiet. The resident snapped at her. "I didn't authorize that treatment." Laura didn't flinch. "She's going into shock," she said firmly. "Her mean arterial pressure is dropping." The resident glanced at the monitor again. Everything looked fine to him. He was about to argue when the woman's heart flatlined. Chaos exploded. Nurses shouted. The monitor screamed. But Laura, she was already moving. Her hands reached the crash. Cart before anyone else. Chest compressions. Perfect rhythm. Perfect depth. She called out orders for medication. "Epinephrine now. Get me a dose ready." Everyone froze. It was like she had been in this situation 1,000 times before. Because she had. Moments later, the woman's heart came back. The monitor beeped, steady again. Life had returned. At that moment, Dr. Whitmore, the head surgeon, turned and saw her. He didn't say a word. But his face said everything. Shock, confusion, respect. Minutes later, the second ambulance arrived. This time, a teenage boy. Minor cuts and bruises, laughing nervously. Everyone thought he was fine. But Laura stopped. She bent down, looked into his eyes. She performed a quick pupil test. Left pupil dilated. Right pupil sluggish. Danger, traumatic brain injury. Quietly, she elevated his head 30 degrees. She started documenting neurosigns every 15 minutes. Nobody else noticed. Nobody cared. But 2 hours later, the boy began vomiting violently. Laura was ready. She had anti-nausea medication in hand. She positioned him so he wouldn't choke. The doctors rushed in, panicked. But Laura had already controlled the situation. The boy lived because of her silent preparation. The third patient rolled in. An elderly man, alert, talking, joking even. Everyone relaxed. But Laura didn't. She saw his hand trembling. Not from fear, not from shock. Something deeper. She checked his medical bracelet. Diabetic. His blood sugar was crashing dangerously, but he was still conscious enough to refuse help. "I don't need anything. Leave me alone," he muttered. Laura knelt down. She held a small cup of orange juice to his lips. "Sir," she said softly but firmly, "I need you to take just one sip. For me?" Something in her voice broke through the fog in his mind. He obeyed. Minutes later, his blood sugar stabilized. The man smiled weakly. "That was the best orange juice I've ever had." One after another, patients poured into Station 4. A man with a hidden spinal injury. Laura immobilized him before permanent damage. A construction worker with a severed artery. Laura pressed down, holding the bleeding until surgery was ready. A young woman with a collapsed lung. Laura caught the missing breath sounds before anyone else. Each time she acted faster than the alarms, faster than the monitors, faster than the doctors themselves, and slowly, everyone started noticing. Doctors glanced toward Station 4 again and again. Residents whispered. Even Dr. Whitmore found himself pulled closer, his eyes fixed on the quiet nurse who wasn't supposed to be doing anything but paperwork. Her hands moved with surgical confidence. Her eyes scanned every patient like she was reading invisible signs. And through it all, she never raised her voice. During a rare pause, Whitmore finally asked her, "Where did you train before this?" Laura froze for just a second. Her pen hovered over the paper. Then she said quietly, "Different places. You learn to adapt." It wasn't an answer. But the weight of her words made Whitmore stop pressing, because in those calm eyes he saw something. Not fear, not hesitation, but history, experience. Something none of his new nurses should ever have. Hours passed, patient after patient, stabilized. And then, the last ambulance arrived, a young mother. Her body was bruised, her arm broken. She clutched her daughter, whispering comfort through the pain. Everyone thought she just needed x-rays and pain medicine. Standard treatment. But Laura noticed her breathing. Every movement made her wince in a way that wasn't normal. She pressed lightly on her abdomen and froze. Her heart sank. Internal bleeding, possibly a ruptured spleen. This time, Laura didn't whisper. She didn't wait. She turned straight to Dr. Whitmore. "This patient needs surgery. Now." He frowned. He started to question her. But then he saw her eyes, steady, unshakable. Not a guess, a certainty. He ordered surgery immediately. 90 minutes later, the truth was revealed. Her spleen had been torn in 2 places. She would have died within hours. Laura had saved her life. As the last patient was wheeled away, the ER finally grew quiet. Staff leaned against the walls, exhausted. Machines beeped softly in recovery. And there, at Station 4, Laura was cleaning, restocking, preparing for the next emergency. Calm, silent, invisible. But Dr. Whitmore couldn't take his eyes off her. This was no ordinary nurse. This was something else. Something he couldn't explain. And he wasn't going to rest until he found out who Laura Keating really was. The ER was quiet again. But Dr. Whitmore couldn't sleep that night. He kept replaying what he had seen. A new nurse, handling cardiac arrests, traumatic brain injuries, hidden internal bleeding, all with the calm precision of someone who had lived these moments before. Her movements weren't guesses. They were muscle memory, the kind of memory that only comes from war. By morning, he couldn't hold his curiosity any longer. He picked up the phone and dialed an old friend, Dr. Marcus Chen, a military surgeon, a man Whitmore had served with. "Years ago. Marcus, I need your help. There's a nurse here. She handled trauma cases last night like she'd been doing battlefield medicine for years." "What's her name?" Chen asked. "Laura Keating. She says she's a recent nursing graduate." The other end of the line fell silent. Too silent. Finally, Chen spoke slowly. "David, are you telling me senior combat medic Laura Keating is working in your ER?" Whitmore's stomach dropped. "Combat medic?" "Not just any medic," Chen whispered. "She's a legend. 3 tours in Iraq and Afghanistan. Her last deployment was Mosul, 2017. David, this woman kept 6 soldiers alive for 4 hours. During an ambush, alone, minimal supplies, enemy fire all around, no anesthesia, no surgical tools, just a combat knife, bandages, and pure willpower." Whitmore felt his throat tighten. This quiet nurse had carried men back from the edge of death with nothing but grit and training. Chen continued. "She was involved in a classified mission. Things went bad. When she came home, she was broken. She disappeared from the military community. Most of us thought she'd left medicine forever. For the first time, Whitmore understood. The way she moved. The way she saw danger before anyone else. The way her hands never shook. It wasn't training from nursing school. It was survival from a battlefield. Later that day, Whitmore found her in the cafeteria, alone, as always, a sandwich on her tray, a medical journal in her hand. He sat down across from her. She looked up, surprised. Her calm eyes searched his face. "Mind if I join you?" he asked. She nodded slowly. "I spoke to Dr. Marcus Chen this morning." Her sandwich froze halfway to her mouth. She set it down, her hands folded on the table. "What did he tell you?" she asked quietly. "That senior combat medic, Laura Keating, was one of the finest trauma specialists the military ever had. That you saved lives in situations where survival was impossible." Laura didn't look away, but for the first time, Whitmore saw the weariness in her eyes. She exhaled slowly. "That person doesn't exist anymore." "The hell she doesn't," Whitmore said firmly. "I watched her save 6 people last night, skills no civilian nurse should have." Laura pushed her tray aside. Her voice was steady, but tired. "I applied here to start over. A clean slate. No one expecting miracles. No one judging me for the ones I couldn't save." Her words hung in the air. Whitmore leaned closer. "Why? Why hide who you really are?" Laura looked down at her hands. When she spoke, her voice was low, because out there every choice I made meant someone lived or someone died. And the ones I lost, they haunt me. Every single night. Her eyes shimmered with pain she didn't show anyone else. When I came back, I couldn't carry that weight anymore. So I became just a nurse. No battlefield, no command, just helping people quietly, without the crushing responsibility. Whitmore's heart sank. He finally understood the walls she had built, but he also saw something else. "You can't turn it off, can you?" he asked softly. "The instincts, the training." Laura gave a sad smile. "No, I see things others miss. My hands move before my brain catches up. Last night, it was like I was back in Mosul." At that name, Whitmore leaned in. "Tell me about Mosul." Laura froze, her jaw tightened. Her eyes went far away, back to a desert battlefield thousands of miles from home. When she finally spoke, her voice was barely above a whisper. June 15th, 2017. Our convoy hit an IED, then gunfire. 6 wounded. 2 critical. Our medic was killed instantly. I was the only one left. Her hands clenched on the table. The evac helicopter was 40 minutes away, but I had men who wouldn't last 10. Her voice cracked for the first time. I performed surgery in the dirt. No anesthesia, no sterile equipment, just combat knives and anything I could improvise. I kept them alive, 4 hours straight, while bullets tore the ground around us. She swallowed hard. All 6 made it home. But inside me, something broke. I couldn't be the one responsible anymore. Not like that. The silence between them was heavy. Whitmore finally whispered, "Laura, what you did last night wasn't just good nursing. It was extraordinary trauma medicine. Why hide it?" Laura looked straight into his eyes. Her voice trembled, but her words were firm. Because when people see you as exceptional, they expect you to save everyone. And when you fail, when you lose someone, it destroys you from the inside out. Whitmore nodded slowly. He understood. But he also knew. This woman wasn't done saving lives, because no matter how much she tried to run from her past, her instincts would always bring her back to the battlefield, even inside the walls of an ER. Laura never spoke again about that conversation, and Dr. Whitmore never pressed. He respected her silence. To everyone else, she was still just a nurse, quiet, ordinary, invisible, but whispers began to spread. Not gossip, respect. People had seen her that night. The way she caught problems before machines did. The way she kept her voice steady when chaos swallowed the room. The way she saved lives without asking for credit. And slowly, something began to change. One Tuesday night, a young nurse named Jessica approached her. Her voice was hesitant. "Laura, can I ask you something?" Laura looked up, calm as always. "Yes? Last week, Mrs. Patterson came in. Her EKG looked fine, but you looked at her once and said, 'She's having a heart attack.' How did you know?" Laura studied her for a moment, then spoke softly. "Because women present differently than men." She wasn't clutching her chest like in the movies. She was sweating, but not from exertion. Her jaw was tight, and she kept rubbing her left shoulder. The signs were subtle, but they were there. Jessica's eyes widened. "Could you teach me what to look for?" For the first time in a long while, Laura smiled. "Of course. But it's not about memorizing symptoms. It's about seeing the whole person, listening, noticing the details everyone else ignores." That night was the beginning. Soon, more. Nurses started asking her quiet questions. "Laura, how do you tell when a patient's crashing?" "Laura, what do these breathing changes mean?" "Laura, how do you trust your instincts?" And she answered, never like a teacher, never with pride, just gently, humbly. Passing on knowledge she had once used under gunfire, she taught them how to read skin color changes, how to notice subtle tremors, how to hear the difference between panic and genuine distress in a patient's breathing. She never called it training. She never claimed credit. She just shared. One night, Jessica rushed into the ER with an elderly patient. The woman only complained of dizziness. Everyone thought it was nothing. But Jessica remembered Laura's words. Look at the face. One side drooping, speech slurred, time matters. Jessica looked closely. Her hands shook. But she said the B words anyway. She's having a stroke. The doctors acted immediately. Treatment began. The woman survived without permanent brain damage. Later, Jessica found Laura in the supply room, her eyes filled with tears. I wouldn't have caught that without you. Thank you. Laura placed a hand on her shoulder. You trusted your instincts. That's the most important thing. Word spread. The ER started to change. Nurses became sharper, more observant, more confident. Doctors began to pause when Laura quietly suggested something. Residents listened instead of brushing her off. It wasn't loud, it wasn't dramatic, but the ER was transforming. Patient outcomes improved. Critical signs were caught earlier. Lives were saved quietly, efficiently, again and again. And at the center of it all was the woman who never asked for credit. During a staff meeting, Whitmore looked around the room. He smiled. I don't know what's happening, but our nurses are catching things earlier. Patients are recovering faster. Something has shifted. One senior nurse spoke up. It's Laura. She's been sharing techniques with us, just little things, but it makes a difference. Whitmore nodded but said nothing. Inside, he knew exactly what was happening. A ripple effect. One woman's experience multiplying across an entire team. Months later, someone scribbled a note on the duty roster next to her name. Cool head, warm heart. Laura saw it. She didn't know who wrote it. But she didn't erase it either. Laura's story is more than just one night in the ER. It's about the kind of heroism the world often overlooks. Not the loudest voice, not the person demanding recognition, but the quiet one, the steady one. The one who notices what others miss. She carried memories of Mosul etched into her heart. A silver bracelet with coordinates she never removed. A reminder of where she learned. the hardest lessons of her life. But she chose to serve in silence, to teach quietly, to let her actions speak, and maybe that's what real courage looks like. Not the medals, not the headlines, but the willingness to keep helping, even when the world doesn't notice. Because sometimes the strongest heroes are the ones who refuse the spotlight, the ones who save lives without anyone even knowing their name. Final impact line. Remember this. The quietest person in the IG room may be the one you'd want standing beside you when everything falls apart.